This program is brought to you by Hometown Veterinary Partners. Learn how you can get on the pathway to partnership at hometownvetpartners.com/vetcandy.
Hey y'all, it's Dr. Deja. I'm a vet with Hometown Veterinary Partners. We're so excited to collaborate with Vet Candy on this project. Want to know more about Hometown Veterinary Partners and how you can get on the path to partnership? Visit hometownvetpartners.com/vetcandy. Best of luck on your tests. Here's Dr. Shannon Gregoire for tonight's quiz night.
Hey there, I'm Dr. Shannon Gregoire, and I'm a graduate of Western University of Health Sciences and now practice in Massachusetts. It wasn't that long ago when I was studying for NAVLE too. I know how nerve-wracking it can be to tackle these topics. And I'm super excited to team up with Vet Candy to go through some quizzes with you. As we dive into this, I want you to be as interactive as possible. Drop your comments and questions in the chat to participate. We're here to support you, so if you ever need anything, just reach out. Let's get started. Question 1. A 3-year-old golden retriever presents with arthritis, lymphadenopathy, fever, and anorexia. The dog lives in an area endemic to Ixodes ticks. Which tick-borne disease is most likely? A. Ehrlichiosis, B. Lyme disease, C. Rocky Mountain spotted fever, D. tularemia, or E. cytoxozoonosis. Think for a few moments about what answer is correct and drop it in the chat box below. The correct answer is B. Lyme disease. Lyme disease is caused by Borrelia burgdorferi and transmitted by Ixodes ticks. Presents with arthritis, lymphadenopathy, fever, and anorexia. Answer A, Ehrlichiosis, is incorrect. While Ehrlichiosis can present with similar signs, it is typically transmitted by amblyomma or rhipicephalus ticks, not Ixodes. C, Rocky Mountain spotted fever, is incorrect. RMSF presents with similar signs but is transmitted by dermacenter ticks and has a shorter disease course. Answer D, tularemia, is incorrect. This primarily causes lymphadenopathy, fever, and oral ulceration, not commonly arthritis. And lastly, answer C, cytozoonosis, is incorrect. This primarily affects cats and causes severe systemic signs and high mortality, not typically seen in dogs. Let's get to question number 2. A 4-year-old German Shepherd presents with fever, anorexia, edema of limbs, depression, and joint pain. Blood work shows hypoalbuminemia and increased ALP. Which tick-borne disease is most likely? And what is the vector? Is it A, babesiosis and Bufillus, B, Ehrlichiosis and rhipicephalus, C, Rocky Mountain spotted fever and dermacenter, D, anaplasmosis and Ixodes, or E, tularemia and amblyomma? Take a few moments to decide which answer is the most correct and drop it in the chat box below. The correct answer is B, Ehrlichiosis and rhipicephalus. Ehrlichiosis, caused by Ehrlichia canis, transmitted by rhipicephalus ticks, presents with fever, anorexia, edema, depression, and joint pain, along with hypoalbuminemia and increased ALP. Choice A, babesiosis bufillus, was incorrect. Babesiosis presents with hemoglobinuria and anemia, not typically the signs described above. Answer C, Rocky Mountain spotted fever and dermacenter, is incorrect. RMSF presents with similar signs but typically resolves within 2 weeks. Choice D, anaplasmosis Ixodes, is also incorrect. Anaplasmosis, caused by Anaplasma phagocytophilum, is typically transmitted by Ixodes ticks and presents with granulocytic signs. Lastly, E, tularemia and amblyomma, is incorrect. Tularemia primarily causes lymphadenopathy, fever, and oral ulceration, not the specific signs described above. Now let's move on to question number 3. A 5-year-old cat presents with dark urine, icterus, fever, and prolonged capillary refill time. Blood smear reveals ring-shaped organisms in red blood cells. Which tick-borne disease is most likely? A. Ehrlichiosis, B. Babesiosis, C. Cytozoonosis, D. Anaplasmosis, or E. Lyme disease. Take a few moments and choose the correct answer to drop in the chat box below. The correct answer is C. Cytozoonosis. Cytozoon felis, transmitted by dermacenter ticks, causes severe systemic signs including dark urine, icterus, fever, and death. Ring-shaped organisms in red blood cells confirm the diagnosis. Answer A, Ehrlichiosis, was incorrect. This primarily causes fever, anorexia, and edema, but not typically dark urine or ring-shaped organisms in red blood cells. Answer B, Babesiosis, is also incorrect. This causes hemoglobinuria and anemia, but is more common in dogs and horses. Answer D, Anaplasmosis, is also incorrect. This normally causes fever and joint pain, but does not typically present with dark urine or ring-shaped organisms in red blood cells. And lastly, E, Lyme disease, was incorrect. Lyme disease presents with arthritis, fever, and lymphadenopathy, not the specific systemic signs described. All right, let's get to question number 4. A herd of cattle presents with weakness, depression, icterus, and staring into space. There is no hemoglobinuria. Blood work shows extravascular hemolysis. Which tick-borne disease is most likely? Is it A, Babesiosis, B, Anaplasmosis, C, heart-water disease, B, D, epizootic bovine abortion, or E, Lyme disease? Take a few moments to choose the correct answer and drop it in the chat box below. The correct answer is B, Anaplasmosis. Anaplasmosis is caused by Anaplasma marginale and transmitted by ticks. This disease causes extravascular hemolysis without hemoglobinuria, presenting with weakness, depression, and icterus. Answer A, Babesiosis, was incorrect. This causes intravascular hemolysis and hemoglobinuria. Answer C, heart-water disease, was incorrect. This causes fatal encephalitis in ruminants, not the described systemic signs. Answer D, epizootic bovine abortion, was incorrect. This causes abortion and enlarged lymph nodes in the fetus, not the described signs in adults. And lastly, E for Lyme disease was also incorrect. This primarily affects dogs and humans, causing arthritis and lymphadenopathy, not the systemic signs in cattle. Now let's head to question number 5. A 2-year-old Labrador Retriever presents with depression, fever, anorexia, and lymphadenopathy. The dog recently had close contact with a wild rabbit. Which tick-borne disease is most likely, and what is the potential zoonotic risk? Is it A, Rocky Mountain spotted fever, minimal zoonotic risk, B, tularemia, with significant zoonotic risk, C. Babesiosis with moderate zoonotic risk, D. Lyme disease with minimal zoonotic risk, or E. Ehrlichiosis and moderate zoonotic risk. Take a few moments and think about the correct answer to drop in the chat box below. The correct answer is B. Tularemia with significant zoonotic risk. Tularemia, caused by Francisella tularensis and transmitted by ticks or contact with infected rodents, especially rabbits, presents with fever, anorexia, and lymphadenopathy in dogs. It poses a significant zoonotic risk and is a potential biological warfare agent. Answer A, Rocky Mountain spotted fever with minimal zoonotic risk, was incorrect. RMSF has zoonotic potential but less risk compared to tularemia. Answer C, Babesiosis with moderate zoonotic risk, was incorrect. Babesiosis primarily affects dogs and humans but poses less zoonotic risk than tularemia. Answer D, Lyme disease with minimal zoonotic risk, was incorrect. Lyme disease can be transmitted to humans via tick bites, but poses less risk than tularemia. And lastly, answer E, Ehrlichiosis, moderate zoonotic risk, was incorrect. Ehrlichiosis has zoonotic potential, but poses less risk than tularemia. Well, that's a wrap for tonight's quiz time. You guys did great. Thanks so much for joining us. We'll catch you next week. Have an awesome time and keep studying hard.